Hello and welcome once again to the American Patriots channel. This is our 12th episode on this channel. Wow, we've come pretty far and we've addressed a lot of issues. Now, here on the American Patriots channel, we address many of America's most significant problems. But we don't just point them out, we actually provide solutions to these problems. Today, we're going to be talking about social welfare. Social welfare is a safety net and support system that has a tremendous impact on the quality of our lives. Well, for today, I have some good news and I have some bad news. So, which would you like first? Well, I know everyone likes to hear good news, so let's start with that. Let's look at all the things that our social welfare program provides for us. There are two main categories of social welfare programs in America, and the first is the welfare programs category. There are 6 major welfare programs, and those are the Supplemental Nutrition Assistance Program, Medicaid and the Children's Health Insurance Program, housing assistance, earned income tax credits, supplemental security income, and temporary assistance for needy families. The other main category of social welfare programs is the entitlement programs, and there are 4 of those: Social Security, Medicare, unemployment insurance, and workers' compensation. As you can see, there are a lot of social welfare programs out there, and those are just the major ones. They're there as a support structure for all of us, and they include a safety net for those that are in need. So that's the good news. We've got a lot of great social welfare programs. Now for the bad news. To start with, these programs, particularly the welfare programs, can influence behavior. For example, if a person on welfare gets a job, they are penalized. They will lose some or all of their benefits. What's up with that? Getting a job is a good thing, particularly someone who is impoverished and needs income. So the system penalizes good behavior. Not only would it penalize someone for getting a job, but it would also penalize someone for getting married. There again, that's not good. We need to encourage people to get married and get jobs, not discourage them. And in addition, it provides no incentive for furthering your education. Now, education is a great tool to help a person to escape poverty, and yet there's no incentive there. They're receiving welfare benefits, and really, what's the use in trying to better oneself and get an education when the income stream is already established? What this does is it establishes a dependency on the system, where a person actually becomes dependent and can't free themselves from the welfare system. And it results in what's called a cycle of poverty, where a family in poverty cannot escape, and the next generation can't escape, and so on. Generation after generation is stuck in poverty, due in part to our welfare system and the fact that it does not encourage people to escape it. So let's take a look at the poverty cycle. Starting with the upper left, if you look at this poverty cycle, you see that there's a family in poverty. And so, of course, their child will grow up in poverty as well. And because of the environment that the child grows up in, they are significantly disadvantaged in terms of education and skill set. What that results in is then they struggle to get a good job. They're only able to find a low-paying job, which really doesn't help them to escape poverty. As such, they fail to escape the poverty cycle, and we start all over again with a family in poverty. And as I've said, this goes on for generation after generation. Can you believe it? We have a welfare system that holds poor people back. It discourages them from getting a job, getting married, and furthering their education. Talk about kicking someone when they're down. That's as un-American as I can imagine. Franklin Delano Roosevelt said this about it: "The lessons of history, confirmed by the evidence immediately before me, show conclusively that continued dependence upon relief induces a spiritual and moral disintegration fundamentally destructive to the national fiber. To dole out relief in this way is to administer a narcotic, a subtle destroyer of the human spirit. It is in violation of the traditions of America." So Franklin Delano Roosevelt agrees that the welfare system, when it discriminates against the poor and holds them back, discouraging them from bettering themselves, is un-American. Now, there are some politicians out there that offer government welfare as handouts, essentially a bribe to get votes. They'll say, "Hey, I'm all for more welfare," and they're utilizing that just to gain votes. They have no reason to provide incentives for people to escape poverty, because if they did, that would eliminate their leverage to get these votes. They're in essence using the poor in that way. These corrupt politicians are serving themselves at the expense of the poor. Good politicians offer welfare, but at the same time of offering a handout, they also offer a hand up. They understand that welfare is important and a lot of people need it. It's great to help them, but at the same time, we need to make sure that our politicians are also offering a hand up to help those who can to escape the cycle of poverty. Let's look at it another way. We could define welfare as a condition where someone is entrapped in a cycle of poverty and exploited by corrupt politicians. And we've seen that that does happen. Now let's look at the definition of another word: slavery. Slavery is a condition where someone is entrapped and exploited to serve another. Those two definitions sound pretty darn similar. We need to stop the exploitation of the poor and provide them with incentives that will allow them to escape the cycle of poverty. Moving on and looking at the housing programs, there are some problems there too. There are not enough government housing units available, and the program is underfunded. So those with low income have difficulty finding a place to live. And then looking at Medicaid, there are many people in our country that are of low income, and yet they can't get on the Medicaid program. Right now there are 14 states that limit access to Medicaid. All right, so those are some of the major problems of our social welfare program today. But let's not stop there. Let's work on ways of not only fixing those problems, but also making the social welfare program in our country better than it ever has been before. Looking at the welfare programs, then, it's very clear that we need to provide incentives for people to escape the cycle of poverty. Now, I'm talking about the able-bodied individuals. There are many people who cannot get off of welfare. That's okay. We understand that completely, and we are encouraged to see that the welfare program is helping them. We want to help them as much as we can. But for those who can escape the cycle of poverty, we need to help them do so by providing incentives. Don't penalize them if they get a job. Don't penalize them if they get married, and give them incentives to further their education. Why not? If a person is on welfare, let's be honest, the standard of living is low. If they can get off of welfare and escape poverty, the standard of living is much higher. Where do we want them to be? Welfare? Not welfare. Welfare? Of course, not on welfare. We want to help them to better themselves. So, our politicians need to understand that although welfare is a very good thing, helping the poor and disadvantaged is a great thing to do, but at the same time, it must be accompanied with incentives to help those who are able to get out of the cycle of poverty. If you see a politician only offering welfare handouts, that's one of the corrupt ones. Look for the ones that do that and in addition suggest ways to help the poor to escape poverty. Vote for that one, not the other one. Ronald Reagan said this about welfare. We should measure welfare success by how many leave welfare, not how many are added. Exactly right. And he's talking, of course, about those who are able-bodied and who would be able to get off of welfare by bettering themselves. And then for housing, well, it's a pretty simple answer there. We need to make sure there's an adequate supply of housing for low-income individuals and families. When it comes to Medicaid, those 14 states need to step up to the plate and provide Medicaid to all low-income individuals and families, just like the other states are doing right now. Now, one thing about this is that would cost a lot of money, and that's why these 14 states are not doing so. In just a few minutes, I'm going to talk about how they and the rest of us can afford to do these things. In other words, afford to provide incentives to get off of welfare, to provide better and more available housing, to provide Medicaid for all low-income individuals, and so on. So hold on for just a minute and we'll get into that very shortly. But let's move on first to how we can improve the entitlement programs. And first up is Medicare. If you watched my healthcare video, which was a couple of episodes ago, you saw that there's different kinds of insurance. There's private insurance and then there's Medicare, which is really just another kind of healthcare insurance. And what we found was that Medicare is most effective at holding down the costs of healthcare. Healthcare is really expensive, and so we said that Medicare is the best choice for healthcare insurance. So now, looking at entitlement programs, we should provide Medicare for all. Right now, Medicare is available to those 65 and older, but we need to have it available to everyone because it's the best choice, again, for holding down healthcare costs. Now, the premiums, deductibles, and out-of-pockets need to be adjusted, though, based on ability to pay. It does no good whatsoever to offer Medicare to someone for free, and yet, if they get sick, they can't afford the deductibles and out-of-pockets. So it's not just the premiums, but the deductibles and out-of-pockets as well that need to be adjusted downward for those with limited means and adjusted upwards for greater ability to pay. And not only that, but Medicare covers some things and it doesn't cover other things. What's up with that? Why not cover all health care issues? Have a comprehensive Medicare program. This is what it would look like. Comprehensive health care would cover medical and dental. Right now, Medicare does not cover dental. In addition, mental health, substance abuse, vision, hearing, prenatal care, preventative care, prescription drugs, and elderly nursing care. Beyond comprehensive Medicare for all, we need to have protection for those with pre-existing conditions, such that they don't pay any more for their insurance than anybody else. Medicare for all should be available to all citizens and immigrants with visas here in this country. Now, right now, Medicare is available to those age 65 and older. I think we should extend that downward to where retirement Medicare is available to those age 60 and over. And along with that, retirement Social Security can start as early as age 62. That too should be extended downward to age 60. Therefore, if a person reaches age 60, they could, if they wish, start Medicare and start their Social Security payments. And then finally, one more improvement is for workers, we need to mandate paid maternity, family, sick, and vacation leaves from work. Now, I'm sure you're probably thinking, well, those sound really great. Those are really the answers to many of our deficiencies in this social welfare program. Would make a really outstanding system in our country, but we can't afford that, right? How could we pay for all those improvements? We were talking about incentives for people to escape the cycle of poverty. Those are financial incentives. For more availability in housing, for Medicaid to be expanded to cover all low-income individuals and families, for Medicare to be comprehensive, and retirement Medicare to be extended down to age 60, along with Social Security. So how could we pay for that? That's got to be hundreds of billions of dollars for all of those improvements. Okay, let's take a look and see how we can pay for all of those. I'm telling you, it can be done. First of all, let's look at the poverty rate. Now, we understand that when someone's on welfare, that costs the government money. If they were no longer on welfare, there would be a savings right there. And we said that there's many people that are trapped in a cycle of poverty. What if we freed them from that with some incentives? What could the poverty rate in our country do? How much could it be reduced if we help people escape that cycle of poverty? Well, let's take a look at it right now. This bar chart shows the level of poverty in a variety of countries. Now, this comes to us from the Organization for Economic Cooperation and Development, OECD. And what it's showing us is persons living with less than 50% of median equivalized disposable income. That's basically a metric that's used to measure whether someone is in poverty or not. Now, the OECD member countries are all of those shown to the left of that space. The United States is shown in blue, and the average of all OECD members is shown in red. Currently, based on this metric, there are 17.8% of the people in our country that are in poverty, whereas the average of all OECD nations is 11.7%. What if, by giving incentives to those who are trapped in the cycle of poverty, we were able to reduce poverty down to that red bar, 11.7%? That would save a lot of money, a lot of welfare money, because those people would no longer need it, and that could be used then to improve the social welfare programs in our country. In terms of paying for the improvements that we have just discussed, if we were to reduce poverty down to the level of the average OECD member country, that would save, in terms of welfare expenses, $387 billion per year. Beyond that, there's quite a bit of fraud in our welfare system, It's estimated that about 10.6% of all welfare expenditures are fraudulent. Now, if we could cut that amount of fraud in half, we would save an additional $60 billion. And finally, if we were to reduce healthcare costs down to the level of the average OECD country, and we could do so by utilizing Medicare to hold down those costs, we could save an additional $1,826 billion. That adds up to a total of over $2.2 trillion in savings every year. Is that enough money to cover all of the improvements to our social welfare programs that we've talked about today? Oh yeah, there is way more money than what would actually be needed. $2.2 trillion in savings every year. That's enough to cover those changes and all of the ones that we've suggested on this channel with a lot of money left over. We've suggested things like free education all the way up through 4 years of college, free tutoring for your children to help them be successful in school, and economic incentives for small businesses to help them grow jobs, which would help the employment for all of us. We need to make these changes, and we know what to do, and we know how to pay for them too. Our politicians need to get on board with these changes. So contact your local congressman or woman or senator and tell them that we need to improve our country and we know how to do it. If they need to, watch this channel, tell them where it's at, and spread the word so that we can get these things done. This will make America the best country that it's ever been. All right, well, that's all I have for today. Next time, we're going to talk about the media. Yeah. I'll bet a lot of you out there don't trust the media because you believe that they distort the facts. They try to present things in a way to sway your opinion. Some of them try to sway you toward the conservative side. Some of them try to sway you towards the liberal side. It used to be when you watch the news, you just got some good, hard-hitting, interesting stories about what's going on around us. But these days, not so much. It's more like a propaganda machine out there, and it's not really all that healthy for our country. So on the next episode, we're going to get down to the bottom of what exactly is going on. All right, well, until next time, God bless you all. I'll see you then.